Quincy Health Commissioner Ruth Jones joining us for a COVID-19 update. And Ruth, I know it's been many, many long hours for you and your team, but we're right in the thick of it now, I guess.
We are, yeah. We're here pretty much 7 days a week, trying to keep up with the surge of cases that we're seeing right now, Joe. A couple of weeks ago, we were seeing on the average 7 to 10 cases a day, and now we're seeing on the average 25 to 26 cases a day. So our number of people that have tested positive are actually doubling right now. So I think we're in the surge. We knew we would be. They were saying between April 10th and April 20th, that's when the surge would happen, and that's really what we're seeing. And we're hoping to kind of hit that plateau eventually and see the curve go down. So.
Right. Is that also because testing has increased too along the way?
Yeah, we expected, the amount of cases to go up because testing has increased. We've got 2 drive-through testing sites now in Quincy, one at Manet Health and one down at Crown Colony at Harvard Pilgrim. And so that's greatly increased the amount of people that can get tested. And also we have seen the National Guard in many different sites in Quincy, nursing homes and assisted livings, doing some testing. So we expected to see the surge of tests.
Yeah, we've heard the stories of nursing homes being infected across the state. Is that happening in Quincy too?
It is, yeah. We're seeing most of, not all, but most of our nursing homes have some cases, and some in our assisted living, some more than others. It's a population that's high risk and a situation where it's a congregate situation that one person can get it and it can spread very quickly. Even though people are using the best, infection control practices, it's just an area where these cases can spread and pass very quickly.
Since last week chatted, there's new guidance for wearing coverings over your face,
right,
in public places. What do you think about that?
Well, I think it helps if everybody does it, but I want people, and I've kind of said this from the beginning, that wearing a cloth mask, which is what the recommendation was from the CDC, because surgical masks and the N95 masks really should be saved for the healthcare personnel, particularly the N95 masks. There is still in some areas in the country some shortages of those masks. But the CDC recommended cloth masks, and we actually have put that recommendation and a video of the Surgeon General making a cloth mask. We've put that on our website, the Quincy City of Quincy webpage, so people can see how to do that, because regular masks are very hard to come by. It is a recommendation, it is not mandatory, and I want people to realize that when you're wearing a mask, you're actually protecting the other person. You're not really protecting yourself with this mask on, but if you were to be positive and not know it, which a good portion of people, it's been found, have been asymptomatic and still tested positive. So if you were walking around not knowing you have COVID-19 and you wear one of these homemade masks, or if you had a surgical mask, it would help the other person. It helps you from passing that out to someone who might be close to you within that 6-foot range.
Okay.
Now, if everybody wears the mask, then everybody's helping each other. But I think sometimes people get a false sense of security by having a mask on, thinking they're not going to be able to breathe in the virus. And that's not what the mask does. It helps you from breathing out the virus if you have it. So I want people to be aware that, yes, the mask is recommended through the CDC to help other people, so it protects other people. And if everybody wears one, well, you're all protecting each other. But just keep in mind that a mask doesn't give you that false hope of you can get closer than 6 feet. Okay. Social distancing is still the most important way to prevent the transmission from this, and we still see people not practicing social distancing.
And as a matter of fact, the guidelines for that have changed too, up from 6 feet to 13 feet now.
Yeah, and I still go by the six, the 6 feet or the 13 feet being most important. The most important thing that we can do to avoid getting COVID-19 is stay home. We have a stay-at-home order. Stay home and stay away from people. That's the best way that you can prevent from getting this disease. And I know not everybody can. There are some essential workers, and if you're going into the supermarket, yes, wear a mask so that you're protecting the cashier that's there. Maybe close to you for a few minutes, but protect that other person from getting any virus that they'll be breathing in. So if everybody does wear the masks, it does help.
Okay.
But I just don't want people to get that false sense of security by wearing a mask, or for example, even wearing gloves. The virus can stay on gloves too. Keep your distance, stay at home, wash your hands, wash your hands, wash your hands. So important.
That really is the insidious part of this virus, isn't it? It's the asymptomatic people that think
they're fine.
Yeah.
And they're looking, Joe, at statistics that come out of the federal government are saying as much as 50% of the people may be asymptomatic who test positive. And we've seen a lot of asymptomatic people that have tested positive, but we've also seen people with a lot of symptoms too. So this is a new virus, and we're only maybe 4 months into the virus, and there's a lot we still don't know about it. But I think everybody is trying their best to come up with, as far as the federal government and the state government and the local boards of health, trying to look at all the guidance, see what's best for us, and try to use whatever information that we have to make sure that we're doing the best and the most that we can to prevent the disease from being spread.
Yeah. Are you seeing the shortages of a PPE in your department, Ruth?
We've been pretty good. In the beginning, we didn't have a lot of personal protective equipment, and then we started to get some. We've had a lot of people donate masks, and we have, we've been very grateful for that. We've distributed it when we could to other departments like police and fire and Brewster Ambulance. But I think the amount that we have right now is pretty adequate. We also had a problem getting thermometers because that's distributed to people that are quarantined and isolated. They need to check their temperature. So we're still having a little bit of an issue getting thermometers, but so far we seem to be okay at this point.
Okay. I guess the latest kind of emphasis now is looking at these antibody tests to see if they can develop some kind of a serum. Yeah.
Yeah, we haven't seen any of these tests yet. I'll be happy when they come, because that would, that's one of the things that we're seeing as far as guidance from the federal government. They're testing everybody and seeing who's had antibodies, and is that a way that we can slowly get back to normal in our society. Have not seen the tests yet. We're going to need an awful lot of them, and they have to make sure that the tests are accurate before we do this. So I think it's gonna, I think it'll be a while before we can really say we're back to normal and doing the things that we did before COVID-19. And, I wonder if life will change forever a little bit. And we'll learn some different things that we should be doing because of this pandemic.
Yeah. What I wanted to ask you too is, have you seen, is the flu still around?
The flu is still around. We're not seeing a lot of information about it, I think, because we're all so focused on this. But I think, we start to see the flu wind down around April and May now. But I think that we're also focused on everything else that we're not really paying as much attention as we normally would this time of year to the flu. But this is usually when we start to see the flu cases start to wind down anyways, which I guess is a good thing. But, flu still remains one of the most transmissible and a lot of cases that we see every year with flu, and a lot of people die every year with the flu. I think it was just kind of superseded this year by COVID-19.
Yeah, it's and something else we don't know yet is if COVID-19 will be seasonal like the flu.
Yep. Yeah, we hear all sorts of stuff just like everyone else does on the news. Right. Is it going to be seasonal? Are we going to get a second wave of this, come, December? And honestly, we don't know. What we hear sometimes is what everybody is hearing sometimes on the news. There's lots of information out there. You have to look at who's giving the information and what sources and when they talk about medications, what studies and how big are the studies. So there's a lot we still have to learn about this virus and about this pandemic.
Yeah. But the initial guidelines still seem to be holding that if you think you're sick, don't run to your doctor's, call first, right?
Absolutely, yeah. You don't just want to walk into an emergency room or walk into one of the freestanding clinics or your doctor's office. You want to call. There are certain guidelines for those being tested. They change periodically. It depends if you're a healthcare worker or a first responder. The guidelines are a little bit different from the average citizen or average resident. And they're going to want to know what your symptoms are. But again, those guidelines are change periodically, and we try to keep people updated. But the best thing, if you're not feeling well and you think you might have this or you think you may have been exposed to somebody, call your physician, because you still do need a physician's okay to go and get the test. The two walk-in sites, the drive-through sites, that we have in Quincy, you still need to speak with a physician before you go there. Mannett, you can call the main Mannett number and speak with one of their physicians, or you can call the Harvard Pilgrim number, which is 617-303-6400. And what they do is they will connect you with a doctor from Convenient MD who will evaluate and see if you're eligible to be tested. Same thing with Mannett, 617-376-3000 is their main number. And again, you will speak with a physician who will evaluate if you are eligible to be tested. We do not want people walking into any medical site. Right. Obviously, if you're having difficulty breathing and shortness of breath, you should call 911 and go to an emergency room. But otherwise, call your physician first, or these numbers first, to be screened out to see if you should be tested. Right.
How are Quincy's first responders holding out? Any COVID-19 cases with them?
I think there might be one or two in the police department. I'm not sure about Brewster Ambulance or the fire department, but doing very well when you compare it to other cities and towns who have large groups of fire and police that are out. The first responders obviously get priority being tested. Right. They have had PPE distributed, and all are very well versed in what the protocol should be. Usually Brewster Ambulance will be the first one going in on a respiratory call because they have the ability to suit up with full PPE, and that's the way it should be. And police and fire will assist as necessary. But it's hard out there for our first responders. They're the first ones on the line. They're going in sometimes blind to a call, and so it's a tough job to be a first responder right now.
Yeah, I know they're testing the homeless too up at the Howard Johnson's.
Right.
Any news from that?
Not specifically. I know that Mannett Health has stepped in to do a lot of testing for Father Bills, and we haven't seen a lot of results yet. But what they're doing is testing, and of the overflow. At the YMCA. The YMCA was great in helping the city develop this area for overflow of Father Bill's residents. And so they're testing people using Howard Johnson's as a site to quarantine until the test comes back.
Mm-hmm.
And then if the test comes back positive, then they're referred to a place to quarantine. There is a hotel in Lexington that was doing that, and they may stay actually at the Howard Johnson's, or if their test comes back negative, then they can go back to Father Bill's. And this is a great way of screening out any positive cases, making sure they're all quarantined, making sure people are taken care of. Yeah,
that seems to be the key to this, really, is separate the ones that are infected, right, so that they don't spread it.
Absolutely. Our biggest thing in a pandemic is to test, take care of those who are ill, quarantine them so that they don't spread it to others, and hopefully we can ride this out. But we're in the toughest time right now, so I can't stress enough for people to stay at home and go out only when they have to. When they do go out, if you can, wear a mask, you're protecting other people, and that's helpful. Stay, at least 6 feet away from somebody, and again, that for if you can make your conversations or your contact with anybody, the shorter the better, because 15 minutes is that zone that we say is considered close contact, and wash your hands frequently. But those are the main things, and especially now when we're in this surge. We're seeing the most cases, and so if there's this many cases, it's much easier for it to be passed if cases are out walking around or people are out walking around.
Yeah, I didn't even ask you, what are the current numbers in Quincy?
So as of today, right now, and it could change in the next few minutes because we get cases constantly, but right now we have this is a total count on cases since this began of 354 cases. Of those 354, 107 people have recovered, so that's really good. We've had 14 deaths so far since this began. And again, we're getting up right now about 25 new cases a day, and hopefully that will plateau off and start to go down as the surge passes, but we don't know when that will be.
Okay. Yeah, there's so many uncertainties and unknowns right now. People just are clamoring for answers, and none to be had. Yeah. Right.
I agree. And as are we, clamoring for answers, and listening to all the guidance and trying to do the best that we can do. But one of the things we do here is contact tracing, and so when we get a case, we have to figure out all their contacts and then quarantine all their contacts. And I know this sounds like a pain for a lot of people. Staying home for 14 days, being quarantined, can be a little nerve-wracking for anyone. But this is one of the main ways of preventing the spread of the disease. And so if we do call you from the health department and say you have to quarantine for 14 days, it's important, and we're calling you because it is important. And so please adhere to quarantine and adhere to isolation if you're a case and you're isolated, because this is a very transmissible disease. We do not want people walking around and spreading this.
Sure. And I mean, it's, as it gets closer and closer to the end of the school year, it's going to be interesting to see what happens in the public school systems.
It will be, yeah, it will be. I'm not sure, and there's a lot of decisions as we go along to be made as far as school and as far as we have a lot of stores that are closed, retail and restaurants open only for delivery, and so a lot of people depend on the decisions being made by public health right now, and so I'm sure all of that will be taken into consideration when these decisions are made, but. First and foremost is protecting the health of people. And so we always err on the side of being cautious. And so it'll be interesting to see, how this goes along and how quickly we'll be able to get back into normal activities. Obviously, we don't want to do that too soon,
right?
Because we don't want to, and this is nationwide. We don't want to see cases go down, and then we go out to back to normal life too soon, and all of a sudden the cases start to spike again, and that would be devastating. So everybody, I think, is proceeding cautiously.
Yeah. Do you know what they're kind of looking for? I mean, how low, I guess, do they have to go before they consider it safe again?
You know what? I don't know. We haven't heard any numbers, any specifics. All I've heard, and I hear a lot from the federal level, Dr. Fauci, and listen to what he says. And, he cautions about doing things too quickly and going back. And there's a fine line here. You want people to get back to work, and you want businesses to get back to being productive, and restaurants back to being open. But you also have a fine line of, do we do it too soon and then risk having another outbreak, which could be devastating. So it's I wouldn't want to be the one making all these decisions. They're tough decisions to be made. And I don't know. I don't know, how long we'll be doing what we're doing, and that stay-at-home order will go on. But, Governor Baker keeps us informed, and we listen like everybody else to federal and state authorities as to day by day what we should be doing. It still is a very fluid situation because there's so much we don't know about this disease.
Right. Anything else that you think we should add right now for folks?
Well, I just think, and I've been stressing this, and I know how hard it is for people to sit at home. And especially when the weather gets nice. Today might not be hard for people to stay in because it's miserable out there, and I wish I was at home. But when the weather gets nice, and if we're still doing this when the weather gets warm, I understand people need to get out and they need to get some exercise, but please, social distancing is so important. Wear masks if you feel comfortable wearing the mask, because it does help the other person. Wash your hands. Wash your hands often, and wash them for at least 20 seconds each time you wash your hands. And those are the most important things. Stay at home when you can. Go out, get some fresh air in the nice weather. I'm curious to see what's going to happen on the beaches when the warm weather comes, because the parking lot is closed for DCR, for Wollaston Beach. But it would be very disturbing to see people congregating real close on the beach in the warm weather if we were still in this stay-at-home order. So, that remains to be seen, but follow the guidance that we're giving you. It's good guidance, and we want to get through this as quickly as everybody does, but we want to do it cautiously.
Okay. Do you still have your information phone number available?
Yeah, the COVID hotline is still, that's just general information. It's not a manned line. It's 617-376-1288. And it just has a recorded message about the symptoms of COVID-19 and testing and things like that, just basics. And then my staff and myself are here every day. And often we've been here since it began on weekends also. But even though city offices are closed to the general public, we're still answering phones. So my line here at the health department is 617-376-1272. If I'm able to, I will answer calls. Anytime somebody calls, you can leave a message, and I try to get back to everybody. So feel free to, if you have questions, give us a call.
Okay. Appreciate your time, Ruth. Really.
Thank you, Joe.
And if we can do anything here at QATV, don't hesitate. Reach out. We'll do our best.
Thank you, Joe. And I just want to tell everybody, we will get through this. We'll get through it together. Just be patient. Be patient.
All right.
All right. Thanks, Joe.
You're welcome.
Take care.
Bye-bye.
Bye now.